Thank you for this great talk. Unfortunately, we won't have the opportunity to re-vote, but I think you convinced some of the panel. So next talk by Daniela Oprea, who will convince us to do next generation imaging with PSMA PET CT.
Thank you very much. Good afternoon, ladies and gentlemen. I apologize for this voice. I couldn't find any recording with a better me. Thank you, the organizers, for the kind invitation, and it's really a pleasure to be here today with you. I'm more than happy to defend PSMA PET. These are my disclosures. There is no doubt that artificial intelligence, and more specifically ChatGPT, has changed the way in which we work today. In the beginning, when AI entered the scene, I was quite skeptical, especially because of the new headings were really fear-inducing. Medical doctors being replaced by AI, imaging doctors being replaced by ChatGPT. The debate is still out, but I'm pretty sure that medical doctors, imaging doctors, will not be replaced anytime soon. You and I will still be here in many couple of years. So, despite the hype for ChatGPT, I think we should use it for the primary indication that it was designed for, to assist us, to use it as an assistant. And therefore, I decided to perform an experiment, and I decided to test the knowledge of ChatGPT regarding PSMA PET to help me in this talk. Therefore, I went to the ChatGPT platform, and then I introduced the magic words, PSMA PET, imaging, and prostate cancer. And God, in a split of a second, everything I have learned in the 10 years before, it was there, the key benefits of PSMA PET in prostate cancer, and even the advantages over other imaging methods. So I could understand why my boss will prefer a robot instead of me, especially with this voice. But since we are not at the ChatGPT Diagnostics, and I missed in all the presentation from ChatGPT the scientific based, here are my 10 scientific arguments pro PSMA PET. First of all, and this is a historical image, it is up to now the most specific target for prostate cancer that we have currently. It is overexpressed in prostate cancer, and it is a biomarker for tumor aggressivity. It offers us the possibility to see what we treat and to treat what we see, the diagnostics applicability. It is the first radiotracer with indication for initial staging of prostate cancer. The glucose analog, the FDG, might be used in a variety of malignancies, but we know it has limited sensitivity for the initial staging and for the recurrent stage of prostate cancer. As for the natrium fluoride, it is really useful. It targets the bone metabolism. It's overused, and it's really important for the bone metabolism, but the problem is it offers us no information about the prostate gland, about the prostate cancer, not information about lymph node metastasis or visceral metastasis. As for the other non-PSMA tracers like choline and also 18F fluciclovine, they have an indication for biochemical relapse, but because of the low specificity, no indication in case of initial staging. And as you can see, the PSMA PET is really useful for this initial staging. It perfectly matches with the anatomical changes where we see the tumor on the CT or on the MRI, like in this case. It also offers us information about the lymph node dissection, and this is really important, especially when we realize that we diagnose patients with lymph node metastasis up to 2-3 millimeters, something that it was not possible before. And there are also publications showing us that because of the high negative predictive value of PSMA, in some cases we can really escape the lymph node dissection simply because we have a negative PSMA PET, though it might be no lymph node metastasis. PSMA PET is also offer us a lot of important information about distant metastases and detection of M1 A disease, lymph node metastasis at distance, but also bone metastasis. And yes, I think for especially the lymph node metastasis, it's important that we will help and will guide our friends from urology and radiation oncology on how to treat the patient. But especially for M1b, it's important to realize that the presence of a anatomical substrate on the MRI or on the CT within this hybrid technique, it's really important in order not to make everybody metastatic before. And then PSMA PET improves the detection in the initial staging setting. In this prospective multi-center phase 3 trial, the sensitivity for PSMA PET was found to be 40% and the specificity 95%. And I know for the critical voices, 40% is not quite high, but I have to say that the detection in this setting of the CT and the sensitivity of CT in this setting is around 25%. So 40% is still the best we can have at this moment. And then PSMA PET has predictive ability for the primary staging. In a meta-analysis, including these 5 studies that are just represented like simply dots, we see that on a per patient analysis, the summary sensitivity and specificity were 77% and 97% respectively. And on a per lesion analysis, the summary sensitivity was observed to be 75% and the specificity almost 100%. And then PSMA PET is a predictive and has a predictive value in PN1 disease, especially when we talk about histology-proven disease. This was a study performed in the largest retrospective cohort data that we have up to now, and it was to perform in order to see what is the oncologic outcome of patients having histological proven disease and having prior to lymph node dissection and radical prostatectomy a negative or a positive PSMA PET. And we see that on the left side, the biochemical progression-free rate of patients having an N0 on the PSMA PET was 14 months compared with 5 months in the N1 disease. And on the right side, you see that also the number of tumor positive, lymph node positive, it was an important predictive factor. Patients having up to 2 lymph node metastases have a BPFS rate of 15 months, and those having a positive PET with more than 2 lymph nodes had a BPFS rate of 4 months. And then we'll be forever grateful to our friends from Australia for this pro-PSMA trial, showing for the very first time within a prospective trial the superior accuracy of the PSMA PET when compared to conventional imaging. There is no doubt that PSMA PET has some advantages, greater treatment impact, and fewer uncertain results. And yet we have up to now in the guideline, the indication for using PSMA PET in patients with high-risk prostate cancer. And now we have mature data to also underline the role and the diagnostic value in patients having unfavorable intermediate risk prostate cancer. So in this study, which was performed in patients with intermediate risk prostate cancer, 1 in 10 patients had a positive PSMA PET. 7% of these patients had lymph node metastasis, and 4% of the patients had distant metastasis, but no visceral metastasis. So right now we think, and there will be an indication also for the use in case of patients with intermediate risk. And the last reason that I would like to introduce, and there is no secret, we know it already, is that PSMA PET has won a place in the guidelines, and this place was already from 2022. It was the very first time when we introduced the indication to perform a PSMA PET for the initial staging of our patients. And as you know, every year we revise these guidelines, and every year there will be a new indication, there will be something new added based on the literature and the publication that you are really greatly doing. And I'm sure that next month at EAU 25, Daria and Phil will discuss the new additional things that we have for imaging in prostate cancer. So really happy to hear these talks. And with this, I would like to come to the take-home messages by saying that indeed PSMA is here to stay because it has an important role for patients with high risk and intermediate with unfavorable risk. There is for sure outperforming conventional imaging, predicts oncological outcomes, and it is well positioned in the guidelines. But I think there is a second take-home message I would like to give you. Imaging doctors are also here to stay. And in terms of stealing jobs, there is no doubt the growth of AI is likely to change things, but nobody will replace the great knowledge doctors like you and the PSMA believers like me. Thank you very much for your attention.